Thank you for choosing Floyd Valley as your healthcare partner, where we're focused on keeping care convenient, accessible, local, and you healthy. In this video, we'll review your colonoscopy procedure, how to prepare, and what you can expect when you head home. You've made one of the most important appointments in your life. Let's learn more about your screening and how you can take advantage of all the post-op care and services available at Floyd Valley Healthcare.
Hi, I'm Dr. Brooke Kahns, and I'm one of the general surgeons at Floyd Valley Healthcare. Colonoscopies are the gold standard for screening for colorectal cancer. Unlike other screenings, colonoscopies are both diagnostic and therapeutic. Not only can we diagnose that there be a colorectal cancer, but we can also remove things before they get to that point and treat. Early detection is the key to the best outcomes. Colonoscopies should be scheduled at the age of 45 for people of standard risk. So who are people of standard risk? People with no family history of colorectal cancer and people with no history of polyps or other symptoms such as bleeding, chronic constipation, or diarrhea. Your primary care provider might recommend a colonoscopy for other reasons than screening for colorectal cancer. The other reasons include bleeding per rectum, constipation, and diarrhea. A lot of people might prefer screening for colorectal cancer at home. This is an option for a lot of people. Cologuard tests are about 92% effective in detecting colon cancer if it's present. Cologuard tests are not recommended for individuals with a family history of colorectal cancer and for people with a history of polyps. At-home tests like Cologuard are typically ordered through the primary care provider.
Hi, my name is Cassie and I'm a surgical nurse at Floyd Valley Healthcare. Today we're going to talk a little bit about how we prepare for your colonoscopy. When I call patients on the phone, they do express fears about the prep, but I'm here to tell you there's really nothing to worry about. Typically, you'll prepare 1 day before the procedure. In some cases, you will do a 2-day prep, but your provider will review that with you. You may need to stop some medications before your procedure, including aspirins, blood thinners, weight loss medications, and diabetic medications. Your primary care provider will give you detailed instructions. If you don't stop those medications, we may have to reschedule your procedure. Foods you cannot specifically have 2 days before your prep would include corn, nuts, or seeds. The day before your colonoscopy, you're not allowed to have any solid foods, but you can have clear liquids. A clear liquid is anything that you can read through. Examples of that would be water, apple juice, chicken broth, sports drinks, clear hard candy, Jell-O, popsicles, clear soda. No red or purple liquids during your preparation for your colonoscopy. There's 2 medications you'll take in preparation, 14 doses of Miralax and 4 Ducalax tablets. You can pick those medications up at a grocery store or your local pharmacy. After your second dose of medication, your stool should be clear to yellow with no sediment in the bottom of the toilet. If you become nauseous or vomit during your preparation, it's important for you to continue with the prep. If you do not continue, it'll be considered an incomplete prep and you may not be cleaned out for this procedure.
When you come for your colonoscopy, it's very important that you do bring somebody with you because you're not able to drive home afterwards. Unfortunately, if we don't have anybody to take you home, then we can't do your procedure that day.
On the day of your procedure, you will show up 45 minutes before your scheduled colonoscopy time. You'll come into the West Clinic site entrance and check in at the registration desk.
A colonoscopy is really nothing you need to be afraid of. We admit you, we get you an IV, and then there's a number of different sedation options depending on your comorbidities and your health insurance provider. And we'll discuss that with you further over the phone. The most common type of anesthesia is propofol, which is a painless nap. During the colonoscopy, while you're asleep, we take a look with the camera, we do a comprehensive exam looking at all the surface, and we look for polyps and any other concerns. So if we find polyps during your procedure, we'll take those polyps out completely, then we send them to pathology. Once the procedure's over, we allow you to wake up. We'll give you something to eat and drink and make sure you can tolerate that. And then we'll come in and talk with you about your results. The initial results we can discuss are how many polyps and what we suspect that they will find. It takes about a week to get pathology results back. But then when we do get those pathology results back, we'll call you personally to discuss those results. And then we'll make any further care decisions if needed. Colonoscopies typically do require some follow-up. The best you can do in your colonoscopy is a 10-year follow-up. However, if we find polyps or other concerns, we usually shorten that. It's not uncommon to repeat your colonoscopy in 3 to 5 years for screening purposes. We typically recommend about 24 hours or until the next morning, where you want to take it a little bit easier than typical. Overall, colonoscopies are considered a low-risk procedure. Some of the risks we do like to talk about with colonoscopies include bleeding. If we take kidney biopsies or polyps, it's not uncommon to see a small amount of bleeding afterwards. If you see more than expected, please call us. Secondly, you can have holes form in the colon as we're passing the scope through. This is incredibly rare, but we always talk about it. Remember, the benefit of early detection and early treatment far outweigh the risks of the procedure. We can't stress the importance of this test. Early detection saves lives.
As always, if you have any questions or concerns, our staff is a phone call away. Thank you again for choosing Floyd Valley as your healthcare partner.